Now to the latest on the spread of the Omicron variant of COVID-19. Georgia is now the 16th state where the variant has been identified, and the CDC expects the variant to continue to spread.
Right now, these are just a handful of cases, but the CDC says the U.S. is averaging about 96,000 new COVID cases per day, and 99.9% of those are from the Delta variant.
With the recent spike in infections and concerns about this new variant, new travel rules are now in effect.
That's right. The main changes are for travelers entering the country. Ugochi Iloka joins us live this morning from Bush Airport.
All right, Ugochi, what are some of the other changes in these new rules?
Hey, good morning, ladies. I'm live here at Bush Airport, as you mentioned, Terminal D to be exact. This is where many of the international flights go in and out of. A line growing just a little bit here, not super busy, but busier than before. Some rule changes include anyone flying into the U.S., regardless of their vaccination status, must show they are negative for COVID 1 day before their departing flight. Now, this means, say your flight leaves this evening, you would have had to take a COVID test yesterday morning and have a negative test result to board the plane. Tests must meet CDC criteria, which includes PCR and rapid tests. At-home test kits, though, must be supervised, and travelers are encouraged to visit local clinics that administer rapid tests and can get results to them quickly. Now, President Biden is also extending the current mask mandate now on airplanes, trains, airports, buses. He extended that from January to mid-March. So you'll have to get used to a lot of these masks still having to wear that in those places a little while longer. We'll keep you posted if there are any more changes to the rules. Kimberly?
Ugochi Iloka live for us at Bush Airport this morning. Thanks so much. And that brings us to your other coronavirus headlines, counting down from number 3 this morning. A Norwegian cruise ship with at least 17 positive COVID cases on board returned to New Orleans today. All 3,200 passengers were tested for COVID before disembarking, and everyone who is infected will self-isolate. Number 2, nearly 7 million children in the U.S. have tested positive for COVID since the start of the pandemic. Half of all teenagers between 12 and 17 are now fully vaccinated, and 13% of kids ages 5 to 11 have received at least 1 dose. And number 1, the FDA authorized monoclonal antibody treatments made by Eli Lilly for pediatric patients under the age of 12. Doctors can give the treatment to kids with underlying health conditions that make them high risk for serious infection. And Steph, as many across the nation get their booster shots, people want to know, is that shot going to protect them against Omicron?
That's the big question this morning. And while we don't have an exact answer on that just yet, the CDC director said they are considering an Omicron-specific vaccine.
Much of that I would have to defer to the FDA, but they're already in conversations about streamlining the authorization of this, of an Omicron-specific vaccine, partially because much of the vaccine is actually exactly the same, and really it would just be that mRNA code that would have to change.
In the meantime, vaccines are effective against Delta, which is still causing the surge here in the U.S. Right now, we are averaging around 96,000 new cases a day. With the Omicron variant making up so few cases and a